Dr. Diane Harper is the chair of the Department of Family and Geriatric Medicine at UofL. She's got an interest in candidates' health records. What should be disclosed and what should be kept private? And what role does the doctor play in all of that? Diane, welcome.
Thank you, Mark. It's good to be here.
Good to see you. All right, we had a little incident a couple of months ago where Hillary Clinton had pneumonia, and we didn't know about it at the time. And then all of a sudden, all this information about both candidates, Donald Trump and Hillary Clinton's health records, started spewing out what we should know, what we shouldn't know, why didn't she tell us that she had pneumonia, etc. What should be disclosed? And you had some thoughts on that you shared with some reporters and some journals. What were those? What's your thought on that?
It's really easy for us as physicians to get an armchair fireside discussion about what kind of health issues somebody may have just from looking at them on a TV clip or listening to a word. And as a primary care doctor, I know that's just not accurate. I know that you really have to have a relationship with the patient. There's so much more to understanding what's going on with that person's health than what you see in a small clip. So I think that it's unfair for us as physicians to go out and say to the media, oh, so-and-so has a disease or so-and-so isn't fit, because we don't really know who they are.
Right. Now you're talking about if a member of the news media came to you and said, Diane Harper, Hillary Clinton just said she has pneumonia. So what does that mean? That you're saying you shouldn't be the one commenting on that.
I should not be the one commenting on that. No, that is between Hillary and her doctor. That is between Mr. Trump and his doctor. That isn't what we can do. It is important, I think, though, for us to raise the question of, are our candidates healthy? I don't think anyone's asked, is Mitch McConnell healthy to be in there? He's 70-some years old, 74 or so. Is Rand Paul healthy? Who are our, Paul Ryan? He's said in the press over and over that many of his family members die in their 50s of heart disease, and he's in his late 40s. So I think that the health of a candidate is important, but I'm not sure that it's an important part that needs to be discussed in debates or in a public media.
But if we don't discuss, if it's important, doesn't that automatically say that you have to discuss it in the media? Shouldn't someone ask the question, hey, can we see your medical records, Hillary Clinton or Donald Trump or Mitch McConnell? We want to see how fit you are and make sure you're going to last through your 4 or 6 years.
Yeah, well, I think that we could think back and look at FDR, who had polio and couldn't stand up, and he wasn't on TV. He wouldn't let people see him because he was afraid of that. And yet he was the longest serving president that we've had in the United States. And no one knew about that. And had they known about it, they might have thought that he wouldn't have been a powerful enough character to stand up against the Russians, to the Germans, in the war, that he might have been able to keep our interests at heart. And so I think inappropriate judgments can happen if you don't have the full information of what's going on. I think there should be a heart-to-heart discussion with a candidate and their physician about, are they fit to take on the rigors of public office? Public office is, I think, more than an Olympic sport. It's a pretty dangerous kind of event.
Dangerous and probably very stressful. I haven't been there myself, but I can probably tell you that it's a very stressful job. We're talking with Dr. Diane Harper, who's the chair of the Department of Family and Geriatric Medicine at UofL, and we're talking about candidates' health records. So in a perfect world, as a doctor, let's suppose Mark Hebert is running for president of the United States, and Diane Harper's my doctor, and we have this discussion, and I may have a few health issues, nothing really bad, but I've got a few health issues. What would you tell me about what I should release and tell voters and tell the media? What would you tell me?
So I would first ask you what you're comfortable with the rest of the world knowing. And I would have a talk with you about making sure that there's no kind of mental incapacity. I think our president has to be able to have full faculties, or any elected official, full faculties, and knowing that they can think clearly and that they can reason well and that there's nothing that's hurting them in that sign. After that, if you have high cholesterol, if you have a big prostate, does the public really need to know that? I think then it becomes a question of what is it that you want to be able to say, and those kinds of issues don't really, I think, affect the ability to carry out an office.
Well, I know Ronald Reagan, at least in his second term, if you believe what historians are saying, there was some indication that his mental capacity was starting to go down in his second term as president. So looking back with 20/20 hindsight, should we have known at the time from Ronald Reagan's doctor or from someone that, hey, this guy is developing some characteristics of dementia, Alzheimer's, those kinds of things?
And that's a really important question. As chair of the Family and Geriatric Department, that comes into our geriatric realm. Our geriatric doctors all the time have to tell patients and their families that you or the patient is no longer capable of driving. You have to give up your driver's license, that you're no longer capable of taking care of yourself safely. And I think that potentially the physician that took care of Ronald Reagan may or may not have had those talks with him, but someone should have had been talking with him. We have to do that all the time. We have to help families make decisions about what's safe and how reasonable the patient still is. Is their dementia interfering with life? Are they going to leave a stove burner on? Are they going to push the nuclear button and think it was the doorbell? So it's that kind of thing that physicians are really obligated through the Hippocratic Oath to make sure that we are very upfront and we say things that may not be most welcome, but we tell it as it is, and we say, really, let's think about what kind of harm you could be doing here.
In a lot of these cases, it's political considerations. Well, I can't tell, I don't want to tell the public that my family has a history of colon cancer, and 2 people in my family have died from it, because they may look at that and say, ooh, this guy may die in office. I'm not going to vote for him. So how do you balance the political consideration when you're running for office versus what perhaps the voters really want to know and the media is probably asking you about your health records? How do you balance that?
I think that is something that they have to balance with their physician about what their comfort level is at release of it.
Personal
It's
decision.
entirely personal about that. And I don't think that the public has a right to know how many ingrown toenails you've had and, how many ear infections and how many different cases of pneumonia. That is not pertinent to your ability to lead.
Okay. Let's move on to talk about a little something different. You mentioned it just a minute ago. You're the chair of the Department of Family and Geriatric Medicine at the University of Louisville. Do you think a lot of people even know that UofL has essentially doctors' offices out in the community where folks can just walk in, that they're just physicians on the street, family physicians?
Well, I'm not sure that it's widely advertised, but I think it's really important in this time, especially in this day and age, that where primary care is everything. Population health, we're looking at how do we help people stay well so that they're not getting sick, and how do we help them manage chronic diseases? And that's what we do. We have 24 family medicine doctors who are in the process of getting licensed so that they're already doctors and they're just getting more experience under their belt. We have faculty, we have our geriatricians that are there. We have our PharmDs, so they're people that actually help us managing patients' medicines. And we're able to provide this comprehensive, what we like to call patient-centered medical home for our patients. So that you come in, and if we tell you, oh, by the way, you have diabetes, we will also go the next step and say, and this is what we need to do, and this is the social services that you need to get hooked up with, and this is our chronic care nurse, and she'll be calling you every couple of weeks to find out how you're doing, and that it really creates a sense of we really want to help you manage your diseases in the best way possible.
And these are essentially family physicians, right?
They are family physicians, yes. They're board certified, have residency programs, and are working very hard to keep the entire family healthy.
And I know some of them are at Cardinal Station, because that's where I go. Where else around the community can I, if I need a doctor, where can I walk in or get an appointment with UofL?
Sure. At this point, we have offices in Newburgh in the Watterson Towers on the 9th floor, and those offices are open. As you said, we have an office on the 1st floor of Cardinal Station. We also have an office on the 2nd floor of Cardinal Station, and we have a sports medicine office, which I think people are not aware of either. But our sports medicine doctors take care of our UofL athletes. They are outstanding in what they do, and so I would encourage people who are weekend warriors or people who are out there doing whatever they have, if they have a sports injury, to think about calling us. We can help you.
Which I did. Dr. Stumbo looked at my shoulder and my back last week. So
she's fabulous.
Because I'm old, I mean,
yes.
As you said, weekend warriors, that's me.
That's right.
And also, is there the idea that when you go to a family physician at the University of Louisville, you also have the whole UofL research and the specialists that are downtown behind you that they can refer you to and say, oh, well, you need to go see this specialist for endocrinology or whatever.
Absolutely. We have an incredible, wonderful set of specialists that are backing behind us that help us with very specific management issues of patients that are harder than usual or more complicated than usual. But we also have, I want to stress something else that people may not think about, is that there is a group called the United States Preventive Services Task Force, and that is a group of primary care doctors who evaluate primary care issues of screening. Who should be screened? How do you screen? What's the right screening test? How often do you screen? And our primary care docs are highly connected to that U.S. Preventive Services Task Force. And so, therefore, we can not only train our doctors, but practice in the very best evidence-based manner on a primary care screening, diagnosis, and treatment that then dovetails very nicely with our specialists.
So if you go to one of these doctors, you're going to get an earful about preventative medicine, right?
Absolutely. Okay. Yes, sir.
All right, Dr. Diane Harper with the Department of Family and Geriatric Medicine at UofL. Thanks for being on the program. I appreciate it.